Good morning, or good afternoon, depending on where you are today. I'm Dr. Aki. I'm an interventional pulmonologist at National Jewish Health and the founder of EON. We're donating our mission-critical safety net solution for free to over 4,000 hospitals during the COVID surge. And just wanted to thank everybody for joining me today for today's daily briefing, where we'll review the latest essential patient curve data, which you can also find on our website at eonhealth.com. Before I do that, I just wanted to set the stage and talk briefly about the fact that cancer won't wait for COVID. And this is why we've tailored our solutions to help essential patients get the immediate care that they need right now before it's too late. So why are we doing this? COVID-19 has disrupted the U.S. hospital and healthcare system workflow and focus. And unfortunately, this means that many facilities that COVID-19 is paralyzing the identification, the management, and care of essential patients. The current loss of focus on essential patient care is resulting in patient distress, risk of long-term suffering, loss of life, poor outcomes, as well as the loss of hospital income. The delayed care may be captured post-COVID, but return to normal hospital operations will not occur until the resulting bolus of delayed care, concurrent with normal care, needs subside. So we have to address this soon, otherwise there will be an avalanche of acute care needs with no or limited prioritization of non-emergent care that will have long-term effects on our populations, hospital, and economy as COVID and cancer are catastrophically intersecting. So what we're doing is we're laser focused on helping identify essential patients as well as improving screening procedures and protocols within hospitals and during COVID. Our patients need us. High-risk patients will go undiagnosed and suffer poor outcomes as a result. An estimated 1.8 million people were expected to be diagnosed with cancer in the U.S. This year before COVID halted identification and diverted treatment resources. Hospitals are at risk too. Just like the volatile stock market, hospitals are at risk of significant financial loss as a result of decreased hospital outpatient and cancer care revenue. Delayed care will also increase the risk of liability in the future. Hospitals are already seeing a loss of up to 40% in 1 month during the COVID pandemic. Unemployment is also on the rise. We're seeing end users who are being furloughed or laid off. We've actually hired some to help us with centralization and managing and helping with the management of these dashboards during this time. So what we wanted to do is today is to show some of the new curves and why this matters. So the first thing that I'll do is I'll pop up and share my screen. And let me just pull this up. Here you can see the curve here where there is an efficiency rating of 95%. And what this means is that by June, the hospitals will get back to a level that's 95% of normal. And what the curves here that you really want to pay attention to is these are the diverted patients here. The green line is the patients that we think are essential patients that would have a more higher likelihood of morbidity and mortality should they not be seen in the next 60 to 90 days. And as you can see here, we can change the level of hospital efficiency, and just small percentage changes in hospital efficiency make dramatic differences in terms of hospitals' ability to work through the backlog that's created by deferment with COVID. And so here you can see the difference between a 90%, which you can see at the end of the year, we still have a backlog that's very similar to May and June. And if you were to change that to 97% efficiency, you can see the difference between the max deferred patients here versus the max deferred patients at the end of the year. These are all found on our website. And what we also do is that we also are creating essential patient lists and a COVID tracker that ties to local bed occupancy. And so let me just show you guys very quickly what that looks like. And I'll share my screen here to show you our mobile app that can be used to manage essential patients. So As you can see here, here is Safety Net. So this is Safety Net here, where you can see that there are essential patients that are, and I'll log in again. There are essential patients in which you can roll through very quickly via the phone app, which shows your patients in order of highest to lowest, whether it be 4X patients in your screening or incidental in terms of the size. And we remove the names here so that we can show you the app. Patients with no follow-up, nodule board, whatever it may be. You can see there's 4 Bs there in the nodule board for review. If I click further into that, I can actually see the actual patient record with the reports online. I can send patients to nodule board. There's the incoming bucket. You can actually handle everything in terms of essential patients from your phone. There's also a COVID tracker that has the patient impact and hospital capacity. All these things are already released for Android, and we expect Apple to release this today to the iOS for use. Any hospital can use the COVID tracker right now. And then in addition, our current sites will have ability to have access to Safety Net. And we're also donating Safety Net, which includes the identification of patients with pulmonary nodules, and then also aggregating them into risk categories, whether they're screening or incidental, so that you can work through patients who need to be seen sooner and triage your patients appropriately. So as you can see, we're also working on, and I'll stop sharing here, that we're working on updating the curves on our website to include those different diversion data that I think is going to be very, very helpful for at least illustrating the fact that you have to become more efficient and you have to triage patients, because the backlog is something that is very difficult to overcome. So the missed appointments during this period is going to result in a backlog peaking in May of about 58 million visits missed. And so I just showed you Safety Net, and what it does is it allows you to identify essential patient when it matters most, track patients with COVID-19 with the patient impact and hospital capacity module, segment patients based on risk, access to the first mobile nodule board, so quarantined service line members have the ability to communicate and make critical patient decisions at any time from anywhere. If you're doing telehealth from home or whatever it may be, you don't meet with a virtual, with a mobile, with a tumor board or a nodule board. This makes it very easy to do so via a phone app. We automate the follow-up, augment your current tumor board with nationally renowned doctors who specialize in nodule management. And then in terms of what we're saying that you can do is that we can ramp up this essential patient Safety Net for you within 1 week with zero cost in 2020 to all new facilities. There's no catch. So our patients in your facilities cannot wait to address the needs of essential patients now. Visit our website, eonhealth.com, right now for the latest essential patient curve numbers with diversion curves that we're tracking in real time. To learn more about Safety Net, to see if you're eligible, it's real simple. If you're a U.S. hospital that has and even if you're an outpatient radiology center and you are going to be eligible for the free offer for Safety Net. Just wanted to thank you guys for joining me today. I wanted to end by stating that today there was 1.8 million diverted office visits. Their total diverted visits today are about 26,295,000. Ambulatory encounters are 5 million that have been diverted, and procedures are 170,000 thus far. So some big numbers in terms of diversion. Please join me tomorrow for a live webinar where we'll be discussing deferred essential patient care during COVID-19 in much more detail. We must restart the hospital engine and get back to our primary objective, patient care. Stay safe, stay distant, and make sure that you see your essential patients now. More tomorrow. Talk to you soon.